Imagine if your heart quit pumping or your liver quit functioning properly. You would want to receive new organs and continue living, but this is only possible because someone else chose to donate his or her organs. According to the U.S. Department of Health and Human Services, in 2013, every 10 minutes there is another person added to the organ transplant list. So in the time you sit here listening to my speech, another person is added to the waiting list. Donating life is priceless. An organ donation does just that. But before becoming an organ donor, you should know what all it entails and some of the risks involved. But ultimately, I think you'll realize that by signing up to be an organ donor, you're signing up to give life. By becoming an organ donor, you can save one or even many lives. And by allowing them to receive your own organs, if the event were ever to occur, you'd be saving their lives. And if one of your family members suffered from a tragic car accident or was a patient who suffered from cancer, you'd want them to receive the new organs if theirs were damaged beyond repair. And this process is not possible without organ donation. People are dying every day due to organ failure. And according to the U.S. Department of Health and Human Services, approximately 79 people are dying or receiving organ transplants each day. But, however, 18 people also die waiting for transplants that do not occur due to the shortage of donated organs. This is incredible. 79 people survive, but yet 18 are dying every day. And according to Donate Life, in March 2013, there were currently 120,000 people waiting, men, women, and children, in the United States to receive organs. And this number is astounding also, and to imagine that 18 of them died today, and another 18 will die tomorrow and the day after, until we all become organ donors. Also, according to Donate Life, anyone can donate, regardless of their age, race, or medical history, and there is no cost to the donor or their families if they donate organs or tissues. Now, I'm not saying that we should all walk into the hospital today and donate our organs, but if a tragedy were ever to occur, by signing up to donate today, we'd be able to save lives in this unforeseen tragedy. According to the organization Life Gift in 2013, they stated that most organ donors are victims of fatal head injuries, spontaneous bleeds, or lack of oxygen to the brain due to cardiac arrest. These patients then undergo testing to confirm brain death, and according to my interview with Dr. Nate Krug on April 28, 2013, he stated that these patients would undergo an EEG, or an electroencephalogram, and they would also be examined by both a neurologist and a primary caregiver to determine official brain death. And of course, no one wishes death on anyone to save organ transplant victims. But according to the Mayo Clinic in April 3, 2010, they stated that one of the greatest myths is that if I sign up to become an organ donor, I think that the doctors would not do everything possible to save my life in the event I would have an emergency. But in fact, these doctors would do everything possible to save my life first before they thought about harvesting my organs for donation. But you do need to know the risks before you get involved. And according to the NPR, on their article in July 2, 2012, they stated that most kidney donors return to life within weeks or even months, but some do suffer from physical and financial complications. Jeff Moyer, who donated a kidney, stated in the NPR article in 2012 that months and weeks went by and his scars faded, but his pain did not. And regardless of how many tests he's undergone, the doctors cannot find out why. And according to CBS in their article February 11, 2009, few of these organ donors die, but for example, 1 in 3 liver donors will suffer from further complications such as hospitalizations or further surgeries. CBS also stated in 2009 that these donors do not have regrets and many of them only have minimal pain. And Jeff Moyer added in the NPR article that this is one of the greatest accomplishments he's had in his life and he would do it again. So even these donors who face complications would do it again, so what's stopping you? The satisfaction of saving a life or donating a life is priceless, but losing a loved one can also be difficult to grieve. And according to Christy Krug, a nurse who formerly worked with pediatrics during post-transplants, stated in my interview with her on April 28, 2013, that this gives families hope and a sense of peace, knowing that their loved one was able to save someone else's life. And Christy knows this firsthand with her work with the pediatrics. And also according to Dr. Nate Krug, who stated in his interview on April 28, 2013, donors should know that they're saving someone else's life and possibly giving them more than from 6 days of life to up to 20 years of life. They both agree that saving a life is worth more than the risks that could occur. And according to the U.S. Department of Health and Human Services, there are over 100 million people who are currently signed up and registered to donate organs. So stop and think that there are over 100 million of us who currently are registered to save lives. And there are people dying due to organ failure every day. So we need to rise above the 79 who are currently receiving transplants and decrease the 18 who are dying and decrease the 120,000 member waiting list. These traumas occur every day despite our efforts to stop. But we can still save lives even though these tragedies occur. And these donors have no regrets. So by becoming a donor, you can save lives. And donating a life is priceless. So join the over 100 million people who have already made that choice today.